Okay. So week 3, end of week 3, next week is exam week, right? So you're going to be taking your exam at this time next Friday during class time, right? If everybody could turn on their cameras, that would be great. And put your face in the camera so I'm not looking at ceilings and walls. I would appreciate it. Thank you. Um, so this weekend's announcement, I'll just do some guidelines for the exams, but it's not different than the previous exams you've taken in the other classes. I would between now and next Friday go in and check your ExamSoft account, make sure it's still current, nothing's wrong with it, so that when you go to download the first exam, there's not an issue. So I would just encourage you to do that. I don't open it up for download until like an hour before the exam. That's the protocol. So you'll get an email from me next Friday at what, 8 a.m. that says your exam's ready to download. Okay. 1 second. Let me. Okay. I think these are Professor Kershaw's students coming in. So welcome to Professor Kershaw's students this morning. Um, Anyway, so you get an email from me next Friday with regards to downloading the exam. Okay. Last night, I sent you an updated copy of the exam review schedule. Okay. I used that copy. I kept the same days, but I moved all my times from 3 p.m. to 9 a.m. in the morning. I had an excellent showing for 9 a.m. in the morning. I had like 20 students, which is really, really good. So I had heard from students that, um, or at least the students in several of my classes have class on Wednesday afternoons. So I moved it to the morning. Anyway, I had 20 students. It was great. So I moved all my 3 exam reviews and my HESI to the morning, same day, but the morning. And then I've also updated Professor Ford's Zoom link. It was incorrect. Anybody tried to go to her review last night? I had one student send me an email that she couldn't get in. Other than that, Professor Ford sent me an email and she didn't have anybody. She didn't have anybody at her review. So that's a bummer. But she did do a recording, which she really doesn't have to do. If nobody shows up, you really don't need to do a review, but she did. So I posted that for you guys last night, I believe, right? Yes? Yes, I thought I did. Um, so she, so now you have 2 reviews, recordings. Okay, you have mine from Wednesday, you have Professor Ford's from yesterday, and then Professor Kershaw does hers on Sunday. So you have one more opportunity for a live session, and then as soon as I get her recording, I'll get it posted Sunday night. Okay?
Okay.
Any questions? So this is week 3. This is the last week of content before your exam. If you have opened up this the blueprint review guide, which if you want to call it a study guide, that's fine. I it's a for me it's a blueprint because I'm taking the categories and the topics right off of ExamSoft. Okay, so that's what's going to be covered on the exam. So I've renamed it a blueprint review guide because that's what it is. So for those of you that have read through it, you've probably read through, sorry, I have a fly flying around me. What we're going to cover today: migrants, rural, homeless, poverty. Okay. So if you've read through that, this might be a review, but that's okay. That's okay. So I would encourage you, um, since it's the end of week 3, it's kind of a break because you have an exam, to go back and look at your HESI study guide, your HESI prep guide, and complete what you can complete on that after 3 weeks. Everybody know what I'm talking about? This. This, right? This is your assignment that's due in week 9. Okay, so please go through and fill out what can be completed. Okay. Migrant farm workers, rural populations, healthy people 2030 goals. Okay, so there's parts of this you can fill out, or there's several boxes you can complete. So again, like I said in week one, this should be a working document. All right, working on it all terms so that by the time you get to week 9, you can just hit submit. And plus, it's your own study guide. You're building your study guide, right? You're building your own study guide. So don't wait till week 9 to complete this, because it will be a very tedious assignment to complete, because you have to go back and, oh, what week did we cover that? What week did we cover this topic? So anyway, that's my suggestion. Okay, for the HESI prep. I'm going to be doing groups this weekend. Break out the groups, send them out. So if you want to start making contact with each other for your week 7 group infectious disease project, and the guidelines for that are in week 7. Okay, so I send out a summary when I send out the groups, so that will be coming this weekend. So how are you feeling about things 3 weeks in?
The other,
Overwhelmed,
yeah,
Pardon me?
good one.
overwhelmed,
With this class?
just all of it to
Yeah.
get all together. It's a lot.
Yeah.
I mean, for all the other mods, it usually took me by like till week 4 to feel comfortable. But I just feel like there's a lot for this one, so I feel like it might take me a little bit longer than week
Yeah.
4.
Yeah.
It's definitely the most so far.
Yeah. 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 Let's see who is coming. Hang on, I've got some people coming in. Okay, I think they're in spots. Okay. All right, so here's the plan for today. Oh, shoot, I need to go in and open up the quiz. I don't think I opened it up for you guys. 1 second. 1 second. So today, I did not. Today we are going to cover the content, right? Go through our notes, our week 3 blueprint notes, cover the special vulnerable populations content. We'll go through that, and then we will take our quiz too, and then we'll go over the quiz. And I just wanted to start out by going, for those of you that are not or cannot attend reviews, I just wanted to give a quick summary on this study guide. Okay, so here's everybody. You should have received this. Okay, everybody should have this. I have copy and pasted your week 1 readings for ease in case you have to refer back to it. Okay, but they're all in there for weeks 1, 2, and 3. The exam is the same as previous exams: 50 questions, multiple choice, select all that apply, and math problems. I would highly suggest, if you have issues with math, that you go back to week 1 and look at the announcement I posted with regards to Professor Bogart and her YouTube training on math, simple math. Okay, it had does everybody remember that announcement? Okay, it has handouts to go along with it. She breaks it down into very simple terms. It's really kind of like Math 101. But I've heard from students the last 2 terms, it's been extremely helpful. So if you struggle with math, go back and look at her tutoring session for math. Okay. Obviously, this is not all inclusive. I have put this together from the readings, the lectures, and the 3 weeks of your blueprint concept notes. That's where the study guide has come from. The concept guide is more like a summary. Okay, so as you start to go through it, I've broken it out exactly the way the syllabus is. Okay, so nothing on here should be new to you. Okay, you had 4 concepts to cover in week 1: introduction to community nursing, levels of prevention, healthy people 2030, and introduction to vulnerability. Okay, this follows right along with your syllabus, falls right along with your notes, your weekly notes. This is just a summary. Okay. Then in week 2, we covered the school nurse, growth and development, common childhood ailments. And I told you there's at least one question on every common childhood ailment. Okay. And then family nursing and family risks. We covered that last week. And then this week, we're going to briefly talk about migrant farm workers, rural population, and then the homeless, poverty and the homeless. Okay, so this guide follows exactly along with your syllabus. There's no new information. It's just summarizing important points about each concept for you. So my suggestion for preparing for the exam is start with this guide. Start with the information in this guide. If you're not understanding it, go back to your weekly notes and read the more extended version. Does that make sense?
Yes.
If then you're still not understanding it, go back to the readings associated with that concept. Okay? After all of that, because that's where everything's come from. After all of that, if you're still not understanding a particular concept, set up a time with me before the exam and we'll review it. Okay?
Okay.
That's the simplest and most direct way I can encourage you to prepare for this exam. If you have a good, now this exam, just like your quizzes, is very clinically focused. Okay, so what are we asking you to do? What is the next gen format? Why are the clinical case study questions coming up? Because part of next gen's philosophy, the progression to next gen is taking your knowledge and applying clinical judgment. And I can tell you the quiz you're going to take today, it's all clinical scenarios. Okay? And I told you at the beginning, this is a very med-surg focused class. Okay? So I can't stress that enough. So as you're reading through these notes, you have to be able to put yourself in a clinical situation and be able to articulate clinically the knowledge that you just learned from these subjects. Make sense? So for like all your childhood ailments, you read through about asthma. And then the questions you're going to get about asthma is a student is presenting with, right? A student comes to the clinic with, a student shows up to the ER with. Does that make sense? What are you going to do? Right?
Mhm.
Does that make sense?
Yes.
Yes. I can't stress that enough. Okay. Clinical, focus clinically. So it's great to have the knowledge, but you got to be able to apply the knowledge to a clinical situation. Okay. So community oriented versus community based. Maybe you're given a scenario of a nurse performing a certain task, or you're given a scenario. Is this community oriented? Is the you're given a scenario that the nurse is performing this particular task. Is she doing community oriented or is she doing community based? Right?
Mhm.
Make sense?
Yes.
So that's how I would suggest you plan on preparing. If you have a good understanding of the concept guide, you're going to do great on the exam. I promise. Okay? Don't overdo it. Don't overthink it. Couple of quick tips. If for all you overthinkers, if the information is not in the question, it doesn't exist. Stop adding stuff into the question that's not there. What if, what if, what if, what if? All right? Stop overthinking it. All the information you need to answer the question is in the question. That's it. And don't change your answers, okay? You have to be, unless you truly accidentally selected, you hit the wrong button and you need to go back in and change, that's fine. But to change answers, you really have to be very concrete about why you're changing your answer. Right? It's not, maybe I heard her say that, or maybe I heard her in lecture say that, or I think I heard it this. No. Mm-mm. Another important one is if you, excuse me, if you come across a question that there's more than one right answer, there could be more than one right answer and it's not a select all that apply. What do you need to do? Go back and read the question. You missed something. You missed a word or a phrase, like what's the first? What's the priority? What's the most important? Make sense? Go back and read it again. You missed something. And then with select all that applies, all that apply, don't be afraid to select all. If all the answers look correct, select them all. When I do student reviews and talking about select, oh, I didn't think that you could select all. You can select all. And then be mindful of negatively asked questions. You have to be able to distinguish between a positive question and a negative question. Can anybody give me an example of a negatively worded question? The nurse is training a new employee. The nurse is observing a new nurse teaching a family about discharge. What does the new nurse say that would indicate she needs more education? That makes sense? So you're looking for something that the nurse said that's wrong. Make sense?
Yeah.
The family is the nurse is doing discharge teaching with a family of kids with asthma. What does the parent say that you know she needs more teaching? So the parent's going to say something wrong or incorrect. She needs more teaching. Does that make sense? And there are negatively worded questions on the exam. So I just want you to be able to recognize them. So technically you're looking for the wrong answer, what they said or did that was incorrect, if they need more instruction or more teaching. Okay? I think those are my major hangups. Okay? All right, let's cover some content here. Any questions about the exam? Guys, will be fine. You'll be fine. Okay.
I have a question.
Yep.
I know I came in late, but I wanted to make sure that I wouldn't be deducted any points because I had no idea that my teacher wasn't going to be in class today. So I was sitting there waiting for her to log me in. And it wasn't until I contacted my classmate to find out what was going on.
Okay. I'll let Professor Kershaw handle that. I'll pass that message on.
Thank you.
You're welcome. You're welcome. Welcome to class. Okay. Does anybody have any questions about what we just covered for the last 20 minutes? Okay. It's Friday. Just remember, it's Friday and it's week 3. All right, let's go through some content. All right, when you guys think about migrant workers, okay, can everybody see my screen? When you think about, I mean, if you don't live in a rural community, or don't have family to live in a rural community, you tend not to really think about rural communities, right? Migrant farm workers. I mean, who thinks about migrant farm workers on a daily basis? Anybody? No. What do you think? What do you think when you hear migrant farm workers? What kinds of things do you think about?
People that migrate from another country to come
S-
here.
Say that again.
People that migrate from another country to come here and work on farms.
Yeah. Yeah. Okay. What else?
I think about when I see those big school buses that have been painted and see them on there traveling together. You know?
Yep. What else do you guys think about?
You probably would think about them not, having insurance.
Yeah.
To, attend doctors
Mhm.
like, everybody else.
Yeah.
Think about them not speaking English very well.
Mm-hmm. Yep. Right on. That's all right on. So let's talk about migrant workers. As somebody said, they come to work on farms, right? And they come seasonally and then they go home. Or they move around to other sections of the country. All right. Which presents a slew of barriers. They don't know what's available to them. Okay, as far as healthcare, resources, language barriers you brought up. They don't have insurance. These are not jobs with health insurance and dental insurance and vision insurance, right? These are daily paying jobs. Okay, so they don't work, they don't get paid. Transportation is an issue. They typically don't have private vehicles. Female migrant workers are much more susceptible to sexual harassment and abuse. Kids, what about the kid? They bring their families along, and the kids are out there working on the farms. Tremendous risks for these kids. Okay, heat, sun exposure, injuries, and that really goes for everybody. Equipment, farm equipment, tools, vehicles, high risk for accidents. One of the biggest risks, and note this please, one of the biggest risks for farm workers is pesticide exposure. That's their biggest risk. Okay, and that's for all kids, adults. Okay. And we know it's factual that our food supply in the US would collapse without the work of our migrant farm workers. Would you agree? I would.
No,
Right? They're kind of the unsung heroes, right? They estimate 2 to 3 million of these workers farm seasonally in the US to help us get food to our markets. Okay? Like I said, they don't have health insurance, they don't have workers' comp, they don't have retirement benefits. Typically, when they get to where they're going, the housing is an issue,
Oh man.
right? Substandards, sanitation issues. One second, I still have somebody coming in. So their housing situation can be very challenging. Okay, overcrowded, lots of people living in one household, structural issues, mold issues, really crowded living conditions, which is a breeding ground for things like TB, right? Communicable diseases, infectious diseases, GI issues, hepatitis. Okay. We also know that migrants obviously don't seek out preventative care. Okay, so they're much more at risk for chronic diseases, poor dental care, obesity, very, very high rates of depression and substance abuse. Okay, the kids, the risks to the kids, malnutrition, again, infectious diseases, dental issues. Maybe they're not immunized. Maybe they have no immunizations yet. They're obviously exposed to pesticides. They're at risk for injuries, and especially disruption to schooling because they're moving all around, right? So
Mhm.
disruption to their school, their academics, their social structure due to constant mobility. It's a rough road. There is what we call the Migrant Health Act. Okay, the Migrant Health Act are federally funded clinics across the country. Okay, I think what are we at now? About 154 migrant health centers in 42 states. And it serves about 3 million people. And these shelters provide primary and supplemental health services for migrant workers in their clinics. And if you're lucky enough to work in a state and be near a clinic, you have these. But I'm sorry, does somebody need to mute, please? Please, with all the background noise. Thank you. And so, yes, that sounds like a lot of clinics in a lot of states, but if you're lucky enough to live in these states and be near a clinic and have access to these clinics, that's great. But they estimate that there's only a small percentage of migrant workers that are served by these clinics. Let's see. We talked about high rates of depression. We talked about pretty high rates of neurological problems as well, such as Parkinson's due to all the chemical exposures. Okay. I have this part highlighted in green here because since pesticide exposure is the biggest risk to migrant farm workers, you're going to need to know for the exam, and you should know for this concept, the difference between acute and chronic pesticide exposure. Okay. I mean, think about if you are chronically exposed to pesticides, what might that look like? You know, birth defects, cancers, blood disorders. Those are chronic effects. Okay. And then the acute memory loss, difficulty concentrating, mood changes, abdominal pain, nausea. You can read through these, but please be able to identify a scenario of, is this scenario of this client who shows up at the urgent care, is this acute pesticide exposure or chronic pesticide exposure?
I have a quick question.
Yep.
Is the blueprint that you're working off of on your screen the same blueprint that we had in the announcements?
Yep, in your week 3 announcement.
Because
Because I don't have that last part on my migrant farm
I
website.
printed it. Yeah, I printed it, and because I follow along with them as you do with them, and I don't have the same one that you do.
I have the review for the exam, but I didn't get a blueprint for today's lecture.
There is a blueprint in the week 3 announcements, and but I printed it, and it's definitely not the same one that you're working off of this morning.
Let's see. That's what I sent you guys.
Like the
Yeah,
one
it's
that
missing
we,
like a
It's right
couple
here.
paragraphs.
it's missing the bottom portion under, like the last part for migrant farm workers is, ours is the Migrant Health Act, so it doesn't have the last.
I'm looking, I'm pulling up what I sent you. Right
Yeah,
there?
ours is missing a couple paragraphs after the
Okay.
Migrant Health Act.
Hang on. Here it is. It's right here. When I was copying and pasting, I left it down here. It's right here. See it? There's your 2 paragraphs. Right? Is that what you're missing?
Yes.
Oh, okay, I see. It's on page
I'm sorry.
3.
Yep. Yep. When I was copying and pasting and trying to organize this for you, I left this down here under rural. Sorry about that.
I see.
Thank
It says
you.
on page 3. You're welcome. Thank you.
Okay. Do you guys see that now? So this belongs up here.
You're not sharing your screen.
Oh. Okay. All righty. I found it. Okay. So it's under rural populations. Okay. It's down here. Wait, let me. Okay. Come on, Kath. Figure it out. Let's see. It's the last 2 paragraphs under right here. Farm workers. So this section right here is the last part under rural. Okay. This belongs right here. Okay. So make a note of that. The last 3 paragraphs under rural populations belong up here. Right here. After the Migrant Health Act. Okay.
Thank you.
Thanks for pointing that out. I'll correct that. Does that make sense? So the information is in there. It's just, I didn't move it up. Okay. Does everybody understand that? Okay. All right. Let's cover rural populations. When you think of rural, does anybody live in a rural area? Have family live in a rural area?
I have, and I'm moving back.
Okay. All right.
Yeah.
What's rural life like?
Quiet, peaceful.
Yep.
Not a lot going on, but I like it like that.
Yep. Do you have a lot of health resources?
Not really.
No. Nope. You have a lot of specialist doctors?
Nope.
Nope.
Gotta drive a ways for that. Yeah.
Yep.
I'm going to work out there, so hopefully I'll be able to help people a little bit
So
more.
what do you guys think about when you think of the rural? Again, if you live in a big metropolitan area, you tend not to think about rural populations, but rural populations are covered under community health. Community health nurses work in the rural areas. Okay. What do you think about when you think rural?
Farms.
Farms.
Country life.
Yep. Right. So go ahead.
Small towns.
Yeah. Back to my.
Sorry, I don't know what I hit.
What?
I said I disconnected myself. I apologize.
Oh, no problem. So farms, small living, villages, right, compared to a larger city or town. Okay. The past decade, we're starting to see a shift in the population moving from the big areas to the rural areas. Okay, there's lots of a lot of the vulnerability is similar to the migrant workers. There are some differences, but there's a lot of vulnerability in the rural areas. Okay, the typical age group is below 18, above 70 or above 65. Residents tend to have lower years of education, fewer college degrees. It's estimated that 25% of rural Americans live in poverty. And it's also estimated that 40% of the rural kids live in poverty. And most at risk, as far as demographics, are kids, racial and ethnic minorities, and then single female household single families that are run by that are managed by females. Okay. Very few have insurance, or they're either uninsured or underinsured, which leads to problems with access, obviously. Okay. And when you don't have access, you don't go get care. Right? Rural adults are much less likely to prioritize their preventative health care. Okay, they're more likely to smoke, have higher rates of alcohol abuse, obesity, much less likely to attend any kind of annual screening, blood pressure checks, cholesterol checks, pap smears, mammograms. And so in turn, it turns out that one of the biggest problems in the rural areas is chronic disease. Right? Because by the time we see them, they're in a much more advanced state of their disease. Would you agree? They don't seek out preventative care. Okay. Chronic diseases like COPD, hypertension, diabetes, cancer are fairly common. It's estimated that 50% of adults that live in the rural areas have been diagnosed with at least one chronic disease. Okay. It's estimated that only 10% of US physicians work in the rural areas. And the population is 25%. The rural population is 25% of the American population, but only 10% of the docs work there. You're not going to have a pediatrician. There's not going to be a high-risk OB, oncology services. You're going to have probably a family physician or a general primary physician that sees the whole community. And so if you have to go for any kind of treatment or any kind of services, you're going to have to drive. It's very challenging public transportation in the rural communities. There isn't a lot of public transportation. And similar to the migrant workers, a lot of the jobs in the rural community they're not jobs with health insurance again, and dental and vision and retirement and all that stuff. So people don't want to take the day off from work to go travel to do appointments. Okay. So when they get sick, they just keep getting sicker. Maybe they can't travel the distance from facility to facility. Okay. So there aren't a lot of services. Okay. We know that in rural populations, there's a higher maternal and infant morbidity rates. Okay. Rural areas lack pediatric obstetric specialists, which I said. Rural clients have a higher rate of depression, which we talked about, higher risk for stress-related conditions, especially when if you're living in poverty. Okay, and there's a high percentage of the rural population that does live in poverty. Okay, so the 4 risk industries in the rural communities are forestry, mining, marine-related fields, and agriculture, farms. Higher risks due to injury from equipment, accidents, trauma, higher risk of cancer, allergies, respiratory conditions, chronic illnesses, developmental delays, all due to it's just not the migrant farm workers. The rural communities are also exposed to pesticides and herbicides exposures. Okay? So lots of challenges, lots of risks. So if you're working in the rural community as a community nurse, you really have your work cut out for you. I mean, you may be the school nurse, you may be the urgent care nurse, you may be the vaccination clinic nurse. And it's really hard to recruit for people to work in the rural areas. Very, very hard to recruit. And it's also very hard to get, say, like hospice services or home care services. Okay, because of the distance that needs to be traveled. Back and forth, back and forth. Okay, so it's beautiful. I mean, living in the rural community is beautiful, no
I hope to
question.
be able to contribute when I'm out there.
What?
I hope to be able to contribute services while I'm out there.
Yeah, yeah. I live in a rural community up in Wisconsin, very rural. I love it. I love it. Absolutely love it. There's just something to be said for the peace, the quietness, the beauty.
Yeah.
It
Serene.
really is. Yeah, yeah. But there's a lot of challenges as well.
Yep.
So, yeah. Homelessness, poverty, talk about this together. So when you're driving down the street and in your own community and you see homeless encampments or families on the street in the street corners with kids, what do you guys think about? Do you
How they
just
survive the summers, how they survive the winter. It's just a lot of things go through my head. I feel really bad for homeless.
Mhm. What about others? I get a lot of students in this class. What do you guys think about homeless people and families and encampments and families on the corner? What do you guys think about?
Trying to make you ask how, what
Yeah.
happened.
How they
Most of
get
the time I think it's drug related. Sometimes, like most of the time I be thinking it's drug related.
How do you know?
Unfortunately, I can speak for myself. I stereotype sometimes because I'll see people and I'm like, maybe you did it to yourself, or but then you have to go back and kind of ask, like, okay, what really happened in your life that led you to this point?
Everybody has a story.
I think that a lot of the times our the people that we like vote for and elect, they don't do as much as they could to help. I feel like a lot of the funds are misappropriated. They don't do enough to help the people. And unfortunately, sometimes people do slip through the cracks in
Absolutely.
the system.
Absolutely. Thanks.
working
I agree. 100%.
working in a jail also.
Mm.
A lot of homeless who come in there, a majority have mental health issues,
Absolutely.
and that prevents a lot of them
Absolutely.
and keeping jobs and just living a decent life. Mental health has gotten out of control in the homelessness population,
Oh,
not being taken care of.
A lot of
Yes,
the homeless you see nowadays too are like a lot of the veterans that their funds got like stopped because they were no longer seen fit to like receive their funds to receive any help from the government.
I totally agree, with the statement that was made, that I mean, you think about the area, the county, wherever you live at, it's enough money in the county to at least have a homeless shelter. I mean, I look where I live, where I stay. I mean, it's a big tourist attraction, but this county is full of money. And when you look around and see people that's homeless, it's sickening because they I mean, it's so much money that go into things like, bridges or, shelter for animals. You shelter your animals before you shelter people. Like something's wrong with that picture.
yeah. Thanks all three to three.
It's heartbreaking.
It really is. Yeah. One of the things we need to remember is we always have to check our own emotions, right? Because the homeless home special vulnerable groups, everybody has a story. We want to let them tell their story, right? The most important thing for us, if we are working with the homeless population, is to establish trust. They don't like to talk about. They don't like to talk about it, right? But if you're working with families that have homeless kids, it's critical to establish that rapport and trusting relationship, because maybe then the parents will agree for the kids to go see a pediatrician or get their shots. Okay. It's estimated that prior to the pandemic, 10.5% was the homeless rate. After it climbed to 17.3. All right. I saw this firsthand in the schools. I worked in the schools during the pandemic. The homelessness rate of families increased huge. It was the huge increase. And remember, homeless doesn't typically mean that people are living on the street. That's one version of homeless. Homeless also means that you maybe are living with a family member or you're living with friends. It's temporary. That's homeless as well, right? So if you don't have a place to go or you don't have a place to be discharged to, you're considered homeless. And I saw a huge increase in homeless families during the pandemic, with parents losing their jobs, businesses closing, parents having to quit their jobs to stay home with kids. Okay? So the reason why homelessness and poverty is lumped together is because poverty is one of the biggest causes of homelessness. Okay, what does it mean to be homeless? Poor, in poverty. It really means you have insufficient resources to take care of your needs or your family's needs. And those are 4 simple needs: food, shelter, transportation, and healthcare. Okay. I mean, how many people do I know that are 1 or 2 paychecks away from being in this situation? A lot. Right? What contributes to poverty, homelessness? Well, unemployment, maybe your job, your business closed down and you lost your retirement. Okay. Inadequate job, education, training, weak enforcement of child support statutes or laws, outsourcing of jobs, and then certainly the increase in number of children born to single women. Lots of things contribute to it. We know that poverty leads to chronic stress, right? Mental health issues, substance abuse issues, high rates of chronic illness, higher infant morbidity and mortality, shorter life expectancy. Do you know the life expectancy of a homeless person is 48 years old? 44 or 48 compared to 78 for a person who's not homeless. Where do we tend to see homeless when they're getting their care, if they need to get care? Where do we tend to see them?
Free clinic.
Yep, community care clinics.
Or the emergency
ER.
room.
Or
the-
even jail, believe it or not.
Yeah. They typically have limited access to health insurance. They don't even know it. A lot of these people who live in poverty and are homeless don't even know what their resources are. Right? They don't know if they have access to health care, access to food, or access to, maybe introduction to job training or learning a trade. Okay? Young children, if you get a question on the exam about who is the most at-risk group that is affected by poverty, that answer is children. Okay? Children of any age, under 18. Okay? What are some effects? Poor nutrition, poor brain development, exposure to environmental toxins, trauma, abuse. And kids have more, and we saw this in the schools, kids have more chronic diseases, more ear infections, more missing days at school, malnutrition, nutritional deficiencies, developmental issues, school issues, academic issues. And they're typically stuck in the cycle themselves, in the poverty cycle themselves, maybe due to increased opportunities in education. Kids are very, very at risk. And then the teens, what about the adolescents? They are much more likely to have less than average academic skills. And this is really important here, guys. They are 3 times more likely to drop out of school. Okay? Teens are 3 times more likely. So if you're asked a question about adolescents and the risks of them living in poverty, there's many important. Can somebody mute, please? Thanks. One of the most important, there's many things we can do for teens, but the most important thing we can do for teens is to keep them in school. Okay, let's take a pregnant teen, for example. Yes, we want her to get her prenatal visits. Of course we do. Yes, we want her to have nutrition education, maybe parenting education. But the most important thing is to keep her in school, because the increase in education, or the longer she can stay in the educational system, the better for her and the baby. Maybe it leads to better decision making, better thinking about decisions. So, okay. We talked about what leads to homelessness. I mean, most homeless people don't want to be in this situation. Something has caused this, some kind of financial event, some kind of mental health crisis, substance abuse issue. And they simply don't have an income. They can't own or rent, or they've lost access to their financial resources. We talked about they have a lot of acute and chronic physical and mental illnesses. I mean, think about it. The exposures to the elements, the exposure to infectious diseases, crowded living conditions, the risks of TB, hepatitis, the violence, the abuse, substance abuse. So as nurses, what can we do? It's vital that we respect the individuality of every person, right? Many factors contribute to homelessness and poverty. Like I said, many of us are 1 to 2 paychecks away from being unable to maintain our own basic needs. It's really easy to stereotype and judge, but often we're wrong. And if we choose to stereotype and judge, we're going to be limiting or really risking any chance of developing a therapeutic relationship with this population. Okay? Like I said at the beginning, make no assumptions. Let them tell their story. Learn who they are. How did they get there? Help them with resilience. We talked about that last week. Help them with coping strategies, resilience, letting them know what their resources are. Is the mother of 4 young kids willing to accept a referral to a pediatrician's office and get these kids checked out and get them immunized? Is a homeless client with substance abuse willing to start to go to an outpatient treatment center that you have resources to? Okay. The last part of this handout notes is just some examples from this week of primary, secondary, and tertiary. And they are covering all three topics we just talked about. So tell me if you don't understand this. So primary prevention. Teach ways to avoid pesticide exposure. Do we all understand why that's primary?
Yes.
Yeah.
Could somebody please mute themselves, please?
Oh God.
Okay. I need to figure out who I need to mute. Hang on. That it? Okay. Sorry for the interruption. We're almost done. So, some primary interventions for migrants. Teach ways to avoid pesticide exposure, right? Avoid it. So we're trying to prevent it before it happens.
Wearing
Maybe-
masks.
What?
Wearing masks, maybe.
Yep, wearing masks. Sure. Advocate for childhood immunizations for the migrant worker. Immunizations are preventative. Maybe advocate for better living conditions. We're trying to prevent something before it happens. Okay? Do you understand why those examples are primary?
Mm-hmm.
Okay. Secondary, screening, early recognition, early identification, early intervention. So we may be screening for evidence of financial instability that may be leading to poverty. Okay, especially those with chronic health conditions. Yearly blood pressure screenings, blood glucose, BMI, cholesterol checks. Educating on the importance of a schedule for cancer screenings, right? Everybody understand why all these are secondary. We're screening for risk, right?
Mm-hmm.
Tertiary, providing a guidance on a non-pharmacological management of lower back pain. So they have lower back pain. They already have something, right? So maybe we're talking to them about how to manage that. Helping a homeless client find and apply for resources. They're homeless. That's the issue. They already have an issue going on. So helping them apply and find resources, that's tertiary. Referring to the health department for treatment of STDs or HIV. They have something. Okay. Teaching a client how to take their medications. Okay. So they obviously have something, a diagnosis, condition they're taking medications for. So we're teaching them how to take their medications, what side effects to look for. Do those make sense?
Yes.
Because one of the goals with this primary, secondary, and tertiary is it looks different with each topic. So a primary, secondary, tertiary intervention looks different from a migrant farm worker versus somebody who's homeless. But the basic premise of each one of them remains the same. Primary is preventative, secondary is screening, tertiary is treatment. Okay? Okay. Are you guys good with all that?
Yes.
Okay. So I'm going to go in. I know I've turned on quiz 2. I don't know if Professor Kershaw has. I'll go in and check her class. So at least my students get going. Everybody can get going on quiz 2. Okay. You don't need to let me know when you're done. I just need everybody back when you're done. It's 10 o'clock. I need everybody back by 10:15, 10:20 at the latest. All right. So you got 15, 20 minutes to do it. I don't need to know you're done, but you do have to submit it. But keep your cameras on. You got to keep your cameras on. All right. And any Professor Kershaw's got into your quiz yet? Has she opened that up yet? Alfreda's shaking her head.
It wasn't this morning.
Is it now?
Okay.
Yes, I just refreshed and it opened. It's open.
Okay, great. All right. So everybody's all set. All right. I'm going to mute myself. Everybody mute themselves. Go ahead and just take your time on the quiz. Okay. And I'll see you in a little bit. How's everybody doing? Do I still have anybody working on this?
Me, I have
Quiz.
2 more questions.
2 more questions. Okay, let me know when you're done.
Okay.
I need everybody to submit. I've got a few students that have not submitted their quiz. We can't review it until you've submitted it. I need everybody to come back on camera. Everybody done?
Yeah.
Anybody still working on it? Chanel?
Yes, I'm done.
Okay, all right. All right. Okay, let's go. Let me share my screen and let's cover it. Okay. Clinical focus questions. Did everybody figure that out? Take your knowledge and put it into practice. So what should the home health nurse anticipate about clients in very rural communities? What should you expect?
They'll
They
have
will be
more likely
more
to have
likely.
complex chronic illnesses.
Yeah. Anybody get that wrong? Yeah, they're much more likely to have chronic illnesses, right? We talked about the rural population. They don't seek out preventative care. They don't have access. The nurse is developing a primary prevention program for members of the rural community. Which intervention is appropriate? Primary.
Provide information
Sun
about
exposure.
sun exposure.
Sun.
Sun exposure. What's A?
Screening.
So what is that? Secondary. A is secondary.
Mhm.
What's C?
Tertiary.
Tertiary.
Why?
Because they already have it.
They already have it.
Excellent. What's D?
Secondary.
Awesome. Great. Good.
Our
Migrant fa-
education,
What?
sorry. Our education was preventive care.
Okay. Whitney.
And I
let me-
didn't see what the sun had to do with people in rural areas, but that's just me.
Okay, so Whitney, let me give my spiel on education. Education is at all three levels. Okay, if we're educating in the primary prevention stage, we're educating to prevent. Okay, so at providing information on minimizing sun exposure is preventative. Okay, it doesn't matter if it was heat exposure, sun exposure, obesity, doesn't matter. Providing information on minimizing something is prevention. You're trying to prevent something before it happens. You get that, Whitney? And then with secondary, you're still
Yes.
educating because let's say you've screened and you've identified risk. Well, the goal of secondary is to kind of reverse that course, right? Before it gets to tertiary. So let's say you're at risk for substance abuse based on whatever, family history, whatever. Then you educate to try and prevent that from happening from that at-risk individual, right? Here's the risks of substance abuse. Here's the risks of obesity. So you're trying to reverse that. Make sense? And then we still educate at the tertiary level because let's say they have something. We have to educate on how to manage the disease or condition, how to treat it, how to reverse, minimize the side effects. I don't know. Does that make sense?
Yeah.
So I don't want you to get caught up in education just being at the primary level.
Mm-hmm.
Okay?
Yeah.
Okay. Does that make sense?
Yep.
Okay, good. A migrant farm worker presents to a migrant outreach clinic complaining of eye irritation, throat irritation, and cough. What are these symptoms of?
Tuberculosis.
It's if they work with chemical pesticides.
Pesticides. That's
Oh yeah.
that's pesticide. That's acute
Yeah.
pesticide exposure,
Yeah.
right? Right. So we're asking them if they work with chemicals at work, right? I mean, all the other things are, you really wouldn't evaluate for conjunctivitis. It's more than conjunctivitis. We wouldn't be requesting an antihistamine. We don't even know what it is. And then we're not really at the point where we have to do a tuberculosis symptom screening.
I don't have an answer for that. Is there something else I can help with?
Is that mine? I don't get why this is going off. Okay, question 4. Now, during a home visit, we note that the migrant worker is living in a small house with numerous other families. Which nursing assessment is a priority? Keyword, priority.
Tuberculosis.
Potentially, go ahead.
tuberculosis symptom screening.
Yeah, yeah. Because we talked about one of the high risks for crowded living conditions with this population is the risk for tuberculosis. Okay. All right, good. Which statement reflects the impact of income on health outcomes? So this is poverty. Okay. Well, it reflects the income of health outcomes. What's the correct answer?
Low income increases risks of chronic illness.
Why?
Because they can't afford insurance. So they don't go to get medical care.
Right. Maybe they can't afford nutritional foods. Maybe they don't have a specialty provider. Yep. What should the nurse anticipate for a family living just above the federal poverty line? Not at or below, above.
Increased vulnerability.
Due to fewer community resources.
Right. Because once you hit that federal
There's
poverty line,
nothing.
what?
There's nothing.
There's nothing.
I was
Right.
stuck on this one a little bit.
So think through, let's think through it. If you are at the poverty or below the poverty line, you have access to lots and lots of resources. Once you go above that, even if
There's
it's
nothing.
just above,
You can't get Medicaid, you can't get insurance, you can't get income assistance, nothing.
Correct. So there's increased vulnerability due to fewer community resources. Does that make sense?
I
Go ahead.
almost went with improved health outcomes compared to those in poverty because it's saying that they were over poverty. So, according to the government, if you're over poverty, then you have the money to pay for insurance.
But if you're only just above the poverty line,
You don't really have the money.
Right.
So you can't pay for insurance. Your job might not offer it.
So what was the answer?
The answer is A.
Yeah, so it was like, I guess letting us know they were above.
Yeah, you make enough
confusing.
to not be
Who is
considered
off?
as impoverished, but you don't make enough to be able to sustain
Right.
yourself.
So it's like you got money, but you got a little bit of it.
Yeah, just a little bit.
It's interesting. In every class I have this week, this question, the exact same discussion came up. Exact same discussion that we are having right now. Okay, number 7, which client is the highest risk for health outcomes related to poverty?
The 15-month-old.
Did anybody get this wrong?
I got this wrong, and I was wondering if you could kind of explain this to me because I'm a little bit confused.
And we were talking about farmers the whole day, and then throwing a baby.
Yeah,
we were talking about farming the whole class, and now But you did say it's
At
always
the
a
end,
child.
we talked about homelessness and poverty, and what blanket statement did I make? Did I make
The highest
race
risk
or
is
the highest
children.
risk?
Yeah, you said that.
The highest
Anybody
risk
under 18.
Yep, the highest risks of highest risks of poverty are with children,
You said it. Yep.
right?
I guess it threw me off because it says without medical history. So
Well, that's even more of a concern.
Right. They haven't been seen since birth, so they haven't had their immunizations, checkups, any other underlying issues they may have. They've never been to a doctor.
Right.
That's why they have no medical history.
Okay, I was thinking of it differently. When I thought medical history, I was thinking like a history of medical illnesses. Like I wasn't thinking of like their medical background history.
Right. I was thinking the baby was healthy.
Right, that's what I was thinking too. Like a healthy 15-month-old baby.
Well, you're kind of reading. That's that overthinking. That's the overthinking. You're adding more into it than that's there. Now listen. All of these are potentially at risk for adverse health outcomes related to poverty. Okay. However, what is the question asking?
The highest.
Who's the highest? Okay, it's a priority question. So again, this is a great example. Sorry, does somebody have to mute, please?
Why they do that? Be quiet.
Or
Why they touching the baby? Mommy, but you hear me crying. Did you the baby first?
Who needs to mute? Yeah, I need somebody to mute, please. Thanks. Okay, thanks. Sorry about that interruption. Sorry. Okay, this is a great question that if there's more than one answer that looks correct, like all these people, all these scenarios in question 7 could be at risk for issues related to poverty. If more than one answer looks correct, go back and read the question. What did you miss? Highest. Who's the highest? We said that in class. Children. Okay, number 8. Okay. Can I move on?
yeah.
Okay. What should the school nurse expect from an impoverished adolescent?
Increase
Dropping out of
dropping out of
school.
Dropping
school.
out.
Yes. Yeah. Right? Obviously, they have an increased risk of unattended pregnancy. They don't have good use of adaptive coping mechanisms, and they have decreased attendance. Okay, so this is the only sensible answer, and we talked about it in class. Okay, which client is at the highest risk? Another priority question. Highest risk for homelessness.
Veteran with post-traumatic stress disorder living alone.
Why? Why is that the highest risk?
Because he has no support. He's
Mhm.
having mental issues, post-traumatic
Yep.
coping skills. So
Yep.
And he lives.
The key word for me was homeless, but he has a home. So that threw me off. He has a home. He's living
That's
alone.
what I said, because it says that he lives alone, so that means that he
Right.
has a house.
He got a house.
Because I was thinking schizophrenia because
Mhm.
they're-
Where did you go? Okay, Whitney. Whitney,
Mental
where
health.
did you,
mental health.
where did
making
you,
up these questions.
where did you get schizophrenia? Is that in the question?
Mhm.
Yeah,
Adult with
schizophrenia is
schizophrenia
living in a group home.
Think about it. We're talking about homelessness, okay? A has a supportive family.
Mm-hmm.
C lives in a group home setting,
Yep.
Mm-hmm.
Support.
right? So the point is that this guy has PTSD or her, and they're living alone.
Okay.
So they have nobody to observe them or,
Okay, that makes sense.
right? That's the way we're looking at it. Nobody talked about, well, oh, they have the income to own a home. You guys are overthinking. Okay.
And then the older child, you said children are, most vulnerable. It's a child on here with no, doesn't say he had any help, family help. These questions to me are just real
I said the
confusing.
children, I said
Are
the
at risk for
children are at
poverty.
most risk for the effects of poverty. I didn't say homelessness. Okay, you guys are reading too much into this question. We know a veteran is a vulnerable population. We know that PTSD is vulnerable. Living alone, that makes this particular person very vulnerable.
I just never thought it on the fact that schizophrenia is often unmedicated, and even though you're in a group home, that doesn't mean that you're getting the proper care. Doesn't mean
Well,
that.
but wait. How do you know that they're not getting proper care? Is that in the question?
That we don't.
Well, so
I know, but I've been in a group home before, and they don't really.
Right, but you're making assumptions that this is not in the question. It's just simply asking who is most vulnerable. Whether, I mean, being in a group's home setting, at least you have a support system.
Support in a home, yeah.
Right. So, yeah, you guys are overthinking, way overthinking.
Basically, what's happening is instead of just, looking into the information, we're going back to, us working in these settings and knowing. We got to subtract that.
Hey, what did I say in week 1 to my students? Please take off all your other hats. Take off your work hats, take off your clinical hats. You are now in the community. Okay, so like one of the students just said, I used to work in a group home. Okay, that's fine, but let's take off that hat for purposes of what we just went over for content. What is the answers to the questions? I need you to take out all those other experiences and focus on what we just learned. Does that make sense?
Yep.
Hey.
I don't know.
Okay, the nurse is working in an outreach clinic at a homeless shelter, so it's giving you the location. What client should be prioritized?
Complain night sweats and unexplained weight loss.
What are those symptoms of?
Tuberculosis.
Okay, that's the correct answer, but hear me out. It's not that the other 3 clients don't have to be seen. They do. Okay, they do. I mean, 2 is an example of a potential infection.
That's why I picked it.
Okay, hang on.
Yeah, I picked that one.
Let me finish. Okay. All these have to be seen. The question is, who is prioritized? Okay, we can treat an infection, but we need to get a handle on TB if there's going to be an outbreak.
Yeah.
Okay, so you have to look, this is another example of you go and look and say, wow, okay, everybody has to be seen here, but you got to go back to the question, who is the priority? And that the priority, it gives you the location, homeless shelter. What are they at risk for? TB outbreaks. Well, you got somebody complaining of night sweats and unexplained weight loss. You better get that checked out pretty soon and figure out if you have a TB outbreak. Okay? So.
I'm so worried about this test. I'm so worried. I'm nervous.
Why?
Because I feel like it's not relying on knowledge. It's relying, I don't know.
Well, all the questions today in your quiz relied on knowledge that we just went through today.
I feel the same way too.
Okay. Who's that?
It's like, I hate when it's like, it depends on it's not knowledge, it's like what you would do in that situation. And
that's the whole next gen focused is taking your knowledge and applying it in a clinical setting. So when we talked about homelessness, we talked about huge increase for TB within this population. The last question says, hey, we're in a homeless clinic. So you have to be able to shift that. Okay, we're in a homeless clinic, so they're at risk for TB. So here's somebody who presents with night sweats and weight loss. You have to connect those dots. Okay, this is applying your knowledge to clinical judgment.
I gotta stop overthinking.
Yeah, overthinking is gonna be a big challenge. Okay.
That's my
like I said,
issue
my first tip was the information's not in the question, it doesn't exist.
Glad these quizzes are only 5%.
Pardon me?
I'm glad these quizzes are only 5%.
Each quiz is worth 1%.
One.
Well, it's a total of 5 quizzes. They're worth 5%. Okay. So each quiz is worth 1%.
That's even better.
Well, but we have to figure out if you scored low, you need to get with Professor Kershaw and go through your quiz and find out why you're low. What didn't you understand about what I presented today?
In your class.
What?
I'm in your class.
Oh, yes, you are in my class. Stay on, Whitney. Yes, you are in my class. Stay on. After, we're going to schedule some time together. Anybody that wants to schedule time to go through the quiz, yeah, we can do that. but it's pretty straightforward. Pretty straightforward from the material we covered today. Is it not?
Yeah.
When
Okay.
you break it down, yeah. Yep.
Okay. All right, listen, I'm done for the day. I hope you guys have a good weekend. I'll stay on for anybody who has questions. And I hope you guys have a good weekend. You know where to reach out.
Are we doing the groups? You say we're getting our
I'm
groups?
sending groups this weekend. I'm gonna work on that this evening. I haven't done that yet.
Okay.
So anyway, yeah, you'll get your groups and your week 4 announcement this weekend. We'll cover week 4 content from next week because it's an exam. We'll cover that in week 5. We'll do 4 and 5 together. But I'll send you out the week 4 information this weekend. All righty?
Thank you.
Good to see everybody. Thanks to Professor Kershaw's students. And then you guys have a great weekend.
Thank you, you too.
Thank you, you too.